Department of Dermatology and also Syriac Skin Laser Center. She will talk about the contouring of chin and jawline. I wish to ask you for a secret of how you look so beautiful lately. So Yongro is asking me.
Thank you for the kind introductions. So hello everyone, so my name is Dr. Thanya Deshan, dermatology surgeon from Mahidol University, Bangkok, Thailand. And this is outline today, so I will talk about the male versus female jawline contouring, Asian versus Caucasians, how about the age of the patient affect lower face contouring, the trend, and also anatomy and technique. So the first thing first, you can see that proportion and features are substantially different in between male and females, and these should be preserved or enhanced in order to avoid feminization or avoid masculinization male into female and vice versa. So you can see that it's quite equal in male, but in female, but in male in the lower third is quite like larger. And also the shape, you can see that in female, we focus on the mid cheek area, and you can see that the bigonial width is like starting to decrease comparing with the bizygomatic width in female. So that is why it makes female like very V-shaped and slimmer face. And comparing with the male, the distance of the bizygomatic and bigonial is quite equal. So that is why in male it looks strong jawline and also angulate jawlines. And also looking for the chins, the distance in between the chin in female is very narrow, so it's from the nostril width to allow width. But in male, the chin width is equal to allow width to the mouth width. So this is like a concept. And also the mandibular angle in male is like quite narrow, so that's why it makes the male jawline more square shape configurations, while in female it's quite wider. So that is why lower face in female is like rounded, oval shape configurations. Another thing is Asian versus Caucasian. This is my patient. She's 42 years old, and you can see that after I put a filler on her, she looked more beautiful and more happy. And if you look closer, I focus on the lower face contouring. So if you can change lower face contouring, especially in female patient, your patient will look better in overall. Why we need to focus on lower face contouring? Because you can see that skeleton features in Asian is different in Caucasian. So in Asian, you can see that we have like strong upper body appearance because that is why we have increased bizygomatic width. But in lower face, we tend to have resolved bony configuration. You can see that we tend to have concave medial maxilla. We tend to have protrude of the chins and also piriform fossa. So that is why if you can improve lower face in especially Asian female patient, your patient will look better in overall. And this could happen in very young age of the female patient, like 35 years old, because we tend to have lower face aging comparing with the Caucasian. So that is why you need to focus on lower face, especially in Asian female patients. How about the trend to what country? So I think beauty is in the eye of beholder, and beauty trend changes according to the generation and ethnicity. But everyone agree that square male jaws increase male attractiveness. But how about in Asian, this in Thai? You can see that mostly they present as the square or rounded view, but what they want, what they prefer is tapered view. And in female as well, so in Thai they present as like 80% rounded view, with it like wider shape configuration of the lower face. But what they want the doctor to treat them is to be like a V-shaped configuration. So that is why you need to listen to your patient as well. And lastly is anatomy. So not just only the ligament and fat that's sagging, also the body resorption. And you can see that ligament usually located at the lateral of the face area. And when it's sagging, you can see that ligament is attached together like sheet of fabric. So it attached from the upper to lower. If you nail the upper ligament, the lower will improve. And when you are aging, your lower face will acts as like a W-shaped configuration. Why? Because in the medial area it fits because we have mandibular cutaneous ligament. And in the lateral area, it's already fixed because we have platysma auricular fascia. So that is why when you are aging, the middle part tend to be sagging comparatively with the medial and lateral part, and it presents as W-shaped configurations. And this is again, and also this is the chin. You can follow the rigid aesthetic line as the concept. So when you are trying to inject the chin, and usually the vessel is located in the lateral area, but there is one vessel, is ascending ventral artery. So this one can cause the chin necrosis and even the floor of mouth and tongue necrosis because it's anastomosed with the lingual artery. So whenever you inject the chin with the sharp needle, try to stay at the midline because this vessel is around like 6 millimeters from the midline. And it's my patient. This patient is the female with the middle-aged woman. So you can see that she has the lower face aging. So if you improve her lower face, it's going to be like very beautiful. But however, you may need to enhance from the upper. As I already mentioned, if you nail the upper ligament, the lower ligament will be improved and you will use less filler. And here that is why I try to focus on nailing the upper ligament first with the ZCL and also enhance the bone resorption, which is the mid-cheek and piriform fossa. And just only nail the upper ligament, you can see her jawline configuration, it gets better, 50%. And then you can use the rest of the filler to focus and address on the jawline with two techniques. The first one is body resorption. So I inject in the mandibular angles, also in the mandibular septum and mandibular cutaneous ligament and chins because I want to stretch all the jawline in the linear configuration. And then you can touch up later on with the cannula using the subcutaneous plane like this. And be careful the facial artery, jaw fat and ascending ventral artery. So first thing first, using the sharp needle to enhance the body resorption and then touch up with the cannula in subcutaneous plane, and this video demonstration. So first thing first, you can draw the badger structure first within the superficial temporal artery, and also psychomedicofacial foramen, which has the artery coming out, and also I draw the upper and lower border of the zygoma. So the point of the injection needs to be in between the superficial temporal artery and psychomedicofacial foramen, and then you can inject at the mid-cheek area and piriform fossa to enhance the body resorption. So everything will be coming up. And then you can focus at the lower area. First technique, using the sharp needle, just only to enhance the body resorption in the mandibular angles and also mandibular cutaneous ligament. But you need to be careful about the facial artery with coming up at the anterior masseter muscle. So that is four spots that can define and enhance jawline contouring. And then you can recut with the cannula technique in the subcutaneous plane in order to make your jawline more precise and more prominent. And this is the first spot, psychomedicocutaneous ligament. You can do like 2 injections around 0.1 to 0.2. And then I inject at the mid-cheek area and the maxilla to enhance the body resorption and create the upper cheeks and piriform fossa. So this is a fast-forward video. So when you do it, your patient, you need to be slow and aspirate every time. And you can see jawline contouring comparing with the non-injected side. And then you can go on with the jawline by using the needle technique, 3 spots. Avoid facial artery, and you can see very nice jawline contouring. And then you can retouch, like touch up with the cannula. So I use Lorient number 6. You can also use number 4 as well. This is for make the jawline very nice and precision, but actually in women you can just only doing the sharp technique, but in male that need like very strong and prominent jawline, you can also doing the cannula technique. You can see like in comparing into the injected and non-injected side. And this again, inject the ligament first in order to lift up everything. 4 spot. Sorry for the fast-forward video. And then inject at the mandibular angle, mandibular septum, and also mandibular cutaneous ligament in order to stretch jawline, stretch everything, and touch up with the cannula in order to enhance the jawline configuration. So again, in middle-aged Asians patients, you need to starting from the upper first in order to enhance the jawline. And here is before and after. You can see even submental fat get improved, and also before and after. And you can see nice jawline contouring comparing with the before and after, and before and after. Upper, before, lower, after. How about a male patient? In a male patient, we usually have the strong upper body contouring. You can just only focus on the jawline area, but you can use the two technique within the sharp needle and also the cannula in order to make jawline very, very nice and well defined. And it's in these patients, I think he is already handsome, but he want more masculine look and more prominent jawline contouring. So for the male patients, again, you can do the two techniques. This is to assess the ratio in between the chin with his wicked aesthetic line, which he has already had good ratio. This is the first part, which is the angle of the mandible, and then mandibular septum and mandibular cuticle ligament, so 3 spots to make nice jawline contouring, and then you can use the cannula to touch up. But in the male, so I try to create a lateral line as well in order to make like a square and strong configuration. So that is another entry point for the cannula here, in order to make like a very angulate and strong jawline contouring. This is Lorient number 6, which I think is very versatile. You can also use in the superficial plane. And then I use the entry point as in the female to create and elongate jawline contouring. And another thing, yes, you can see in between treated and non-treated side. And again, in this area, like repeat the procedure. 3 spots at the bony area. And also utilizing the cannula to refine the shape of the jawline configuration, make it more well defined. And another line within the lateral line, utilizing the Lorient number 6 with the cannula. And also I use another entry point to define the widening of the chin, because in male we want the chin a little widening, it's not like pointy as in female. I think I have I'll show the technique a little bit here. So this is another entry point along the lower border of the marionette crease. And then you can use this one to enhance the chin widening. And as you can see, this is before and after jawline contouring, very nice jawline contouring. And it's like a moldable and also very natural. Here and here. So this is a key takeaway. This is the last slide for lower face contouring. First, you need to know the difference in terms of the proportion of male and female. Asian versus Caucasian is different. The age of the patient is matter. So if the patient had middle-aged Asian woman, try to correct the mid-cheek first, because if everything lift up, the jawline contouring will be improved. Trend in your countries. Discuss with your patient. The 2 is Lorient number 6. And anatomy and technique will help you to prevent complications. Thank you very much.